really does add up. So if you use these drugs, you can see these savings almost immediately. Now, most prescriptions, they already have a generic equivalent, but in the case of Lipitor, you may be able to stay with the brand name and save money as well. Now, what Pfizer is doing is negotiating with benefit managers like Medco to lower copays on the brand name. That's to try to hold on to as many customers as possible. Of course, Brooke, if you're in this situation, you should really check your plan to see which is the cheaper option.
Of course. But to his point, 10 to 20 bucks, I mean, that certainly adds up over time. So potentially good news for users, but what about the drug industry?
Yeah, well, you know what, they call it the patent cliff for a reason. You think of yourself as part of the company. You've got your sales, they're coasting along, and then bam, overnight, poof, 90% is gone. And for decades in the past, drug companies had another blockbuster drug just waiting in the wings to pick up the slack, but that's not happening anymore. So what we're seeing is more consolidation and thousands of layoffs. It's leading one expert to say that this is devastating to the American medical innovation itself.
But
you can't remove 300,000 people, shut down facilities, and then recover. So what's going to happen is we're going to contract out our work to China, first the chemistry, then the biology, and the Chinese are going to go, well, what do we need those guys for? So they'll be doing the drug discovery work, and if we're lucky, we'll get what they invent. Now, there's something extremely pathetic about that.
Now, Pfizer alone has let go of 41,000 employees since 2005. It plans to cut about 17,000 more. Now, it opened research operations in Shanghai in 2005 and added a second Chinese R&D facility last year. But you see how the consolidation could happen just as consumers are helped out by the cost of these medications.
Allison,